Hello and welcome back to InterpreterPrep.com. This is the third part of a series of 4 presentations on the digestive system. We'll be continuing our journey down the digestive tract where we left off at the stomach. In this presentation, we'll be talking about the liver and gallbladder. Once the chyme exits the stomach, it'll come in contact with bile from the liver and pancreatic juice in the duodenum. These secretions will help to break down and absorb fat, proteins, and carbohydrates. But before I go on, let's talk a little more about the liver and gallbladder. The liver is the largest gland in the body. We see it here in the upper right quadrant of our blue man's abdomen, highlighted in red. The liver produces and secretes about half a liter of bile per day. It's a dark yellow liquid which you probably got a taste of sometime when you vomited a lot. It tastes bitter. The bile flows out of the liver through a series of ducts, which we can see in green in this next image. The two hepatic ducts come together to form the common hepatic duct. The gallbladder looks like a green pear seen there on the upper left of the image and is located under the liver. It has its own duct which joins the common hepatic duct to form the common bile duct, which ends at a nipple-like structure called the ampulla of Fodder. In this image, a part of the duodenum was removed to show the ampulla in the lumen of the duodenum, and the see-through pancreas lets us observe the pancreatic duct, which also ends at the ampulla. So now we understand that it is through the ampulla that the bile and pancreatic juice pour into the duodenum, which is the first segment of the small bowel. Just to be clear, the liver makes the bile and the gallbladder stores it in between meals. Bile facilitates the absorption of dietary fats in the intestine and contains a dark pigment called bilirubin, which gives our feces their brownish color and makes our urine yellow. The liver also helps regulate glucose in the body by storing it when there's too much of it and by releasing it out to the bloodstream when it's needed. Glucose is like gasoline for the cells. It's basic cell fuel. Other functions of the liver is to make proteins, make clotting factors needed for the blood to clot, and detoxification, because the liver's enzymes convert potentially harmful substances like alcohol or medicines into less toxic ones. Remember, everything we eat is absorbed in the intestines and then goes to the liver via the portal venous system. The liver also stores copper, vitamins, and iron. Well, not that iron, oops. So let's quickly review the digestive process. So far, the food was chewed and mixed with saliva to form the bolus as discussed in part 1. Then the bolus was swallowed and pushed down the esophagus where it reached the stomach and was broken down further by the pepsin and hydrochloric acid found in the stomach as discussed in part 2. Here in part 3, the partially digested food, the chyme, exits the stomach and comes in contact with the pancreatic juices and bile in the duodenum where further digestion takes place. Now let's talk about some signs and symptoms of disease. A patient can come in for jaundice, which is a yellow coloration of the skin. When the liver gets sick, it can't process the bilirubin well, and the bilirubin starts to accumulate and leaks out into the skin, making it look yellow. Patient can also come in for abdominal pain. A patient can also come in complaining of dark urine, and this can be due to too much bilirubin leaking into the urine. can come in because of light-colored stools, which means that the bile is not reaching the stools because of blocked bile ducts. A patient can come in complaining of itchiness since the salts contained in the bile leak to the skin causing itching, and the patient can also complain of flu-like symptoms which can be seen in acute hepatitis. Now, let's mention some liver diseases. First, we have cirrhosis. In the image, we see a normal liver to the left and a liver with cirrhosis to the right. Cirrhosis is hardening of the liver and is due to chronic liver inflammation, which causes scarring of the liver. It's mainly due to alcohol abuse. As more and more scars appear in the liver starts shutting down. The inflamed liver literally starts crying, and its tears fill the abdomen with a liquid called ascites, causing a puffy belly. So for those of you out there partying hard, you might want to give that a second thought. Then we have primary biliary cirrhosis. In this case, our own body makes antibodies against the liver's ducts. Diseases that result when our own immune system attacks our organs are known as autoimmune diseases, and primary biliary cirrhosis is one of those. Then we have hepatitis. Hepatitis is the inflammation of the liver. When this occurs, the liver swells up and starts to leak its enzymes into the bloodstream, which is detected in blood tests that show elevated liver enzymes. Hepatitis can be classified as hepatitis A, which is the type you see in school kids, hepatitis B, which is a sexually transmitted disease, hepatitis C, which is a blood-borne disease transmitted through intravenous drug use or a blood transfusion. In the case of hepatitis C, the patients don't turn yellow. There's no jaundice. Hepatitis A, B, and C are all caused by a virus. The problem with Hep B and C is that they can result in liver cancer many years later. Hepatitis can also be caused by medicines, and for unknown reasons, our body can attack our own liver, causing what's known as autoimmune hepatitis. Then we have liver cancer, as we can see on the left side of that image. Another disease of the liver is fatty liver. This can be caused by drinking, but is reversible if one stops drinking, which is not the case with cirrhosis. Once you have cirrhosis, you're stuck with it, and stopping the drinking will not cure it. Fatty liver can also appear in people who don't drink, and in those cases is generally not dangerous. Then we have gallstones. When gallstones form inside the gallbladder, they give way to intermittent pains called colicky pain, a type of pain which comes in waves. If the gallstone travels out of the gallbladder, moves down and gets stuck in the bile ducts, cholecystitis, which is the inflammation of the gallbladder, can occur, or even worse, pancreatitis can occur if the stone gets lodged in the ampulla, blocking the pancreatic duct. Now, let's discuss some diagnostic studies. We have abdominal ultrasound, which is useful to detect gallstones. We have liver needle biopsy. In this case, a needle is put into the liver to obtain a tissue sample. We have CAT scans and MRIs, which are used to obtain images of the liver and bile ducts. And we also have the labs. There are blood tests done to assess liver function, like liver enzymes and bilirubin levels. Now, let's discuss some treatments. There are medicines like interferon used to treat chronic hepatitis B and C. This medication boosts the immune system response. Then we have steroids like prednisone and immunosuppressants, like azathioprine, which are used to treat autoimmune hepatitis. They slow the immune system down. We also have liver transplant, which is done in end-stage liver diseases like cirrhosis. And there are certain surgical procedures used like cholecystectomy, which is used to remove the gallbladder when the gallbladder is full of stones. Certain surgeries are also done to remove small liver tumors. Then we have paracentesis. Paracentesis is a procedure in which a needle is introduced into the abdomen to obtain a sample of peritoneal fluid, or it's done to drain the excess fluid in the abdomen when the patient has developed ascites. And I'd like to mention that there are vaccines available on the market to prevent hepatitis A and B. Doctors who specialize in diseases of the liver are called hepatologists, which is a subspecialty of gastroenterology. Now it's time for review. So let's go over the terminology mentioned in this presentation in English and in the target language. Liver, hígado, gallbladder, vesícula biliar, bile, bilis, pancreatic juice, jugo pancreático, protein, proteína, carbohydrate, carbohidrato, ducts, conductos, common bile duct, conducto colédoco, glucose, glucosa, clotting factors, factores de la coagulación, enzyme, enzima, copper, cobre, vitamin, vitamina, iron, hierro, jaundice, ictericia, dark urine, orina oscura, light-colored stools, heces claras, itching, comezón, cirrhosis, cirrhosis, ascites, ascites, primary biliary cirrhosis, cirrhosis biliar primaria, hepatitis, hepatitis, elevated liver enzymes, enzimas hepáticas elevadas, blood-borne disease, enfermedad de transmisión sanguínea, autoimmune hepatitis, hepatitis autoinmune, liver cancer, cáncer de hígado, fatty liver, hígado graso, colicky pain, cólico, cholecystitis, cholecystitis, pancreatitis, pancreatitis, abdominal ultrasound, ultrasonido de abdomen, needle biopsy, biopsia por punción, interferon, interferón, prednisone, prednisona, immunosuppressants, inmunosupresores, liver transplant, trasplante de hígado, cholecystectomy, cholecystectomía, paracentesis, paracentesis, end-stage disease, enfermedad terminal. In this presentation, we've gone over many terms related to hepatology while we discussed the anatomy of the liver and gallbladder, signs and symptoms of sickness, diseases, diagnostic procedures, and some treatments were also discussed. At the end of the presentation, a list of 39 terms were provided in English and in the target language for you to review. I hope you've enjoyed this lesson and come away with a better understanding of hepatology and the terms related to this field of medicine. Thank you for choosing InterpreterPrep.com. I'll see you back in the next presentation.